different kinds of episodes. She has like some kind of trauma. She has flashbacks where you can't tell if she's dating back, how far back she's dating back to these flashbacks, or you can tell that she's having them and she has different emotions towards them. It could be really negative. It's turned into almost self-destructive behaviors have occurred as well. She's had trouble sleeping and concentrating in various tasks she has to do. She's easily startled or frightened. And it's like some kind of memory or event has been bringing back something that she doesn't want to be around. She avoids things. There's been a lot of like negative changes in the way she thinks and the mood she has compared to how she used to be. And she's finally came to her senses, and she's told us that she was part of rape, like somebody raped her. So as a result of that, it was determined that she had post-traumatic stress disorder, which includes problems in her central nervous system, which is her brain and her spinal cord. Post-traumatic stress disorder is an emotional disorder characterized by extreme fear and anxiety that result from a traumatic experience. Things can result from like a bomb explosion, people who were in the army before, like a lot of veterans have PTSD, any kinds of people who have accidents as well. In her case, it was rape, something really hard that affected her, so of course it's going to have an outcome on her, and it happened 4 months ago, but on a lot of episodes and times it could, just pop out of nowhere where she comes back to thinking of what happened in that time period. Some of the symptoms are exactly what she has. A lot of disturbing flashbacks, avoidance, negative mood changes, and stuff like that. A doctor or experienced healthcare professional can help treat the patient for PTSD. A lot of ways for her to go back to normal would be for her to accept what happened and be hyperactive with her body again, like exercising, enjoying nature, things like that. There's also there's medicines that can help, calm down her anxiety and help her sleep, because like I said, sleep is something that's damaged. There's antidepressants she can take that help the symptoms of depression and anxiety. It helps improve her sleeping problems and concentration. There's also anti-anxiety medications that improve the feelings of anxiety and stress for a short period of time. So these would be able to help her by the time being of her going through treatment and stuff like that. Cognitive therapy would be the best thing for her to undergo. It can be provided for those who have PTSD. And the therapy helps her recognize basically the ways of her thinking and behavior. So cognitive patterns that are keeping the person stuck. So it will kind of get her into thinking, that she can move on from it, and that it can't happen anymore. Like, she can overcome her fears. The patient would be treated for, depending on the time and how she's recuperating, how she's changing, and coping with everything. Patients should be treated once a week to talk about it, typically, and interact with the healthcare professional as well. A lot of interaction with other people, like family members, friends. A lot of, like encouraging words and love and affection would really help the person overcome it. Like I said, the nature and duration of this treatment, based on the severity of it, the improvements in mood and other symptoms within a few weeks can determine the duration of the patient. But it is something she can overcome and, go back to normal and feel like she is somebody wanted and like she has a purpose here.